Well, good morning, ladies and gentlemen. Welcome to this meeting of the Board of NHS England. We're meeting this morning in London, and we're meeting in public. We have public with us in the room this morning, and also, of course, our many followers online with the live stream. So we've got a busy agenda this morning. Before we kick off, may I just welcome everybody and let you know that we have no apologies for the meeting this morning. Secondly, to invite any declarations of interest on any items that are on the agenda over and above those interests which have already been declared. Are there any specific items this morning? John Byrne.
Quite, but I am co-PI on a grant from an academic health science network, which we will be touching on, so I have a research interest in the output of the academic health science networks.
Okay, thanks, John. We will note that. Just to report also that, as always, there is no fire alarm test due this morning, and if the fire alarm does go, then we will invite everybody to follow the guidance of our team. The minutes of the previous meeting have been circulated. May I invite the board please to approve them? Thank you very much. Are there any matters arising? I have no matters arising from the minutes of the previous meeting. No? Okay. Move on then to item 3 on the agenda, and that is the Chairman's report. Simply to report briefly on 2 or 3 areas of activity that I've undertaken since we last met. The first is to note that our last meeting on the 25th of May was at a time when PERDA was in full swing. And the papers that we discussed at that meeting were subsequently published. Now the general election has taken place and we have continued with a strong and stable board. We, I think, can celebrate today the laying of the annual report and accounts before Parliament, which took place on Tuesday. We're coming back to them on the agenda today, but just to record, as I would like to record personally, my grateful thanks to everybody who made it possible for those to be delivered, to be approved by the National Audit Office and to be laid before Parliament in a timely manner. It's an immensely complex job to consolidate the accounts, to produce our annual report and to proceed entirely in accordance with a timetable. And many people around this table and beyond in our organisation have taken responsibility for that, and we should be grateful as a board for them doing so. The Secretary of State's assessment of the performance of NHS England has also been tabled before Parliament. This is a formal part of the accountability of our board and of our organisation to Parliament, and the assessment, I would say, was fair and balanced and highlights a number of areas of achievement of the board. In terms, secondly, of my personal activity, just to report that I have spoken at a number of events. One was to give the annual lecture of the Town and Country Planning Association, which was this year on our theme of healthy new towns. Secondly, to contribute with a keynote to a personalised medicine conference in Vancouver on the theme of genomic medicine and the work that we're doing on the 100 Genomes programme. In connection with that also, I have visited a number of genomic medicine centres in our programme in England, principally the 3 accelerator sites for cancer, which are North Thames, based at Great Ormond Street, South Thames, based at Guy's and St Thomas's Hospital, and the West Midlands, based at the QE Hospital in Birmingham. And just to observe 3 quite different models of engagement, all of them growing into maturity, and particularly in West Midlands, where we have now got not only QE Hospital signed up, but 17 local delivery partners, 17 other NHS trusts who are now open for business and participating in the programme, which involves both the acquisition of tissue samples and liquid samples and their submission through to the main programme, and then the receipt of actionable clinical reports from Genomics England Limited. So the programme is still growing, still gathering traction, but I think what persuaded me most, and particularly in the West Midlands, was the strength of clinical enthusiasm that this was starting to be transformative not only of the delivery of genomic medicine, but the delivery of cancer care, and beyond that, in the way in which those 18 partners were starting to work together in a network in a way which hadn't previously been experienced across that very large region. Other activity, various meetings with chairs of the other arm's-length bodies, which is still an important part of the way in which we relate to our colleagues. A meeting of the Ministerial and Industry Strategy Group, particularly focusing on the emergent life sciences industrial strategy. A meeting with the Deputy Secretary of Health from the Australia Department of Health, again pursuing an interest in genomic medicine and the prospect of partnerships between countries in taking forward the programme. A meeting with the Biosciences Industry Association as part of their annual Parliament Day, and then with Ian Dodge, a meeting of my Special Advisory Council of CCG chairs, where we spent some time analysing the perspective of NHS England and its work from their viewpoint, and understanding some of the challenges that they saw currently in their operating model. But also, I think, from within that, I sense amongst the chairs of their support for the STP process. I think some concern about some of the obstacles that they saw about their ability to participate fully in them, but nonetheless a sense that they were up for the action and were committed to making them work. So finally, I think it's important to note in the week in which the BBC has been very clear about the remuneration of its leading men, to note that our leading man, the Chief Executive, has decided yet again, and despite my pleas to the contrary, to take a 10% discount from his salary. His remuneration, therefore, will remain constant for the present year. And I would wish publicly to commend that action and to say that it brings him up almost to the level of a senior woman working for the BBC. And we should celebrate that, Simon. Thank you. So that is
Yes,
the end of the chairman's report to the board.
Temporarily lost of words. I was saying to Malcolm earlier, it is remarkable that a nurse who acts in a programme called Casualty earns 10 times more than a nurse who actually works in a casualty. That irony won't have been lost on 1.3 million people across the National Health Service. However, in picking up your lead, Malcolm, since May 25th, when we last had our public board meeting, a quick recap of some of my external activity. I had the opportunity, shortly after the Grenfell Tower disaster, with Claire Murdoch to visit the Westway Centre and a mosque, talk with imams, survivors, families in the local community, and want to pay tribute to the extraordinary efforts of GPs and CPNs from the Mental Health Service in that community in response to that, which frankly was in contrast to some of the other, the effectiveness of some other aspects of the response. And that was a very stark conversation, talking with families, some of whom had just attended funerals for their loved ones that very morning. I think once again we've seen a brilliant response from the NHS and the trust with which those staff who live and work in the community, they're not different from it, these are their friends and neighbours, I think was on full display. Earlier this week I visited Broadmoor High Secure Psychiatric Hospital and talked to patients in the High Secure Intensive Care Unit and their staff about some of the challenges facing our high secure mental health services. With my national director colleagues, we have been to Bradford and Scotland since the last public meeting for a range of wide range of conversations with local health, local government leaders, community leaders in both Bradford and Scotland. I had the opportunity to speak at the Local Government Association annual conference in Birmingham and met with Andy Street, the newly elected Mayor for the West Midlands. I spoke at the NHS Confederation annual conference in Liverpool and earlier this week at the King's Fund alongside three of our SDP leaders and with Jeremy Hunt about the first tranche of capital allocation which we've made to the best performing STPs post-election. I think many of the key points are going to be covered elsewhere on the agenda, Malcolm, but I would just draw attention to two other publications which have arisen since our last meeting. The first being the research from the Commonwealth Fund, and I declare an interest as a non-executive director of the Commonwealth Fund, and had nothing to do with the research or publication in question, but was pleased once again to see them assess the National Health Service as the top performing health system of the 11 major industrialised countries that they studied. And although there's been some commentary on that, I don't think it's properly reflected the fact that those results showed that we'd had the fastest decline in deaths amenable to healthcare over the course of the last decade. Our performance on that measure is now better than Germany or the US. But it also points to the fact that we've got further improvement to make on areas such as stroke mortality, and so the actions that we are taking through STPs to ensure the further concentration of hyper-specialist stroke services as advocated by the Stroke Association patients groups, and the investment we're making in mechanical thrombectomy, they will help there. And on cancer survival, early cancer diagnosis being absolutely critical here, part of the conversation that as we look at the CCG annual scores today and the SDP rankings, form a key part of the sort of focusing of those rankings for the action that we know needs to be taken. But finally, in that, guise, it's also important to note that at 9:30 this morning, the annual Cancer Patient Experience Survey was published, and it was very pleasing to see that over the course of the last year, again, there have been statistically significant improvements in patients' experience of cancer services alongside the survival increases, the medical increases in outcomes that we've seen, including improvements in how patients say that they were quickly looked after in terms of getting appointments and test results and their treatment. So credit to all involved for that as well.
Well, thank you, Simon. Any questions or comments on either of our reports? No. Well, thank you there for noting.